In the mid-1980s, the first cases of HIV were detected in the Soviet Union. Most of them involved African students who were studying at universities in Moscow and, in some cases, passed the virus on to local residents. By that time, people in the USSR had already heard about HIV. State propaganda claimed it was a biological weapon created in the West, an experiment that had gotten out of control. The news called the new disease the plague of the 20th century and eagerly reported on new infections in the United States. At the same time, Soviet citizens were reassured that they had nothing to worry about. They were told they were safe. For example, in 1986, the Minister of Health of the Russian Soviet Republic stated, "In America, AIDS has been raging since 1981. It's a Western disease. We have no conditions for this infection to spread because in Russia there is no drug addiction, no homosexuality and no prostitution." At the time, very few people could imagine how soon these propaganda slogans would collide with a harsh reality. Today, I'm gonna tell you about the first documented outbreak of HIV in the Soviet Union. It happened in 1988 in the city of Elista, in the Republic of Kalmykia, in southwestern Russia. Children in several families suddenly fell ill with an unknown disease. They were constantly sick, new and unexplained symptoms kept appearing, and doctors couldn't figure out what was causing it. The children were unsuccessfully treated with standard medications until one of the young patients was tested for HIV. The result came back positive. When other children with similar symptoms were tested, it became clear that the city was facing an outbreak of a new and extremely dangerous virus, one for which there was no cure at the time. To investigate the deadly outbreak in Elista, a young epidemiologist and infectious disease specialist was sent in, Vadim Pokrovsky, the son of the chief epidemiologist of the USSR. This is what he looks like today. A year earlier, he had already encountered HIV. He had investigated the so-called patient zero among Soviet citizens, a Ukrainian man from the city of Zaporizhzhia named Volodymyr Krasichkov. He was gay. In 1981, Volodymyr worked as a translator in Tanzania, where he became infected with the virus. By the time he came to Pokrovsky, he already had advanced AIDS. During questioning, it turned out that while serving in the army, Volodymyr had sexual contact with 25 soldiers. All of them had already been discharged and had spread out across the country. 5 of them contracted HIV, and one of those infected turned out to be an active blood donor. Without wasting any time, Vadim Pokrovsky began investigating the new outbreak in Elista. He discovered that the one thing linking all the patients was the same hospital. They had all been treated there. So, the first step was a full inspection of the hospital. Very quickly, his fears were confirmed. Because of negligence by the medical staff, syringes were being reused, and the virus was spreading through blood. At the time, this was a common practice in the USSR. Disposable syringes were still something new. Healthy children who were admitted to the hospital with a cold or minor injuries were being discharged carrying a deadly virus for which there was no cure. One single injection changed their lives forever. A review of the children's medical records revealed another disturbing pattern. Whenever a child's condition worsened, they were sent for treatment to larger neighboring cities. But the syringe problem was repeated there as well. As a result, smaller but identical HIV outbreaks appeared in nearby regions too. In total, 75 children and 4 adult women were infected. Finding patient zero and understanding how HIV had reached Kalmykia turned out to be far more difficult. The region doesn't border any other countries and has no seaports. In the 1980s, Kalmykia was a remote backwater. Until recently, it didn't even have a railway connection. Almost the entire population of the republic was tested for HIV. Only one man turned out to be a carrier of the virus. Because of his unusual past, he immediately became the main suspect. Back in 1982, he had been serving in the Navy. His ship docked in the port of Congo, where sailors used the services of local prostitutes. At that time, the region was already facing a severe HIV epidemic, so it's most likely that this was where he became infected. After finishing his service, he returned to the USSR, got married and had 2 children. The younger one was born with the virus. Later, genetic studies confirmed that this sailor was indeed patient zero. The chain of infections began with his family. By the mid-1980s, the Soviet Union had adopted a policy of glasnost, which means openness. And for Pokrovsky's young patients, this turned into a cruel twist of fate. In the eyes of society, the infected children were not victims of medical negligence or a tragic mistake. They were seen as carriers of a terrifying and contagious disease. After the outbreak was reported on nationwide news, panic spread across the country. People demanded that the infected be locked away in isolation wards. Protest signs appeared near the hospital reading, "AIDS lives here" and "Let's cleanse the motherland of AIDS." Some of the victims couldn't withstand the harassment and tried to take their own lives. Others moved far away from Elista, but even in their new homes, people treated them with fear and suspicion. 40 years have passed since then. About half of the infected children died from the disease before effective treatment was ever developed. Many of them didn't even live to adulthood. But some did survive. Thanks to antiretroviral therapy, a number of them are still alive today, and some have even gone on to have healthy children of their own. In 1989, the USSR's Prosecutor General's office opened a criminal case against hospital staff, but in the end, no one was ever convicted. The harshest punishment was dismissal from their jobs. After years of legal battles, some of the victims managed to receive compensation from the state, but the amounts were small, just a few $1,000s. Today, Russia has the fastest growing HIV epidemic in Europe and one of the fastest in the world. More than 1.5 million people in the country are living with HIV. In about 70% of cases, infection happens through unprotected heterosexual contact. Only around half of those infected receive antiretroviral treatment. And medical negligence in handling blood has never fully disappeared. For example, in March 2019, more than 100 children with cancer were infected with hepatitis C in a hospital in the city of Blagoveshchensk due to non-sterile medical instruments.